Hello, hello. Sorry, I'm a little late. I was trying to figure out how to not have my background look like I was on a beach as much as I wish I was on a beach. Anyhow, Happy New Year to you. This is our first live of 2022. So I'm super excited about doing these lives and trying to keep them consistent. If you are new to the group, welcome, welcome. I'm Melissa Biscardi, registered nurse, manual osteopath, and my clinical practice focuses on concussion, recovery, brain health, and optimization. I'll have to turn my notifications off. There we go. So let's see. Oh, but I do want to talk about that. So introduced me. Yes. So today's topic is a topic near and dear to my heart. We are going to talk about medications, over-the-counter medications, but certain ones in particular, and why they're so important for your patients to know about side effects and how it might actually be interfering with recovery, making things worse, or just interfering with general health overall. So the reason why this topic is so near and dear to my heart, because it's actually what led me into the brain health sort of sphere. So some of you may have heard my story before, but essentially what happened was for many, many years, I suffered from disturbances in my sleep. And it really got worse over time. Started as not being able to fall asleep. I was always very light in terms of like a light sleeper and having trouble fall asleep, but it got worse and worse over time. This is like over 10 years worth of sleep disturbances. And at its peak, I was waking up at least 10 times in the night. And then when it got even worse, I was waking up multiple times in the night, famished, needing to eat. So I didn't know why I couldn't sleep. I just knew that I couldn't sleep, and that it was really, that it was really interfering with my life. So I started to take over-the-counter sleep aid, over-the-counter, thinking, this thing is safe. And so I took it over time. It kind of helped me sleep, but honestly, I still wasn't sleeping well. But nonetheless, I took it over a long period of time, maybe 2 years. And I did not realize it was related, but I started to lose my memory. And my memory loss was progressive. It was slow. In the beginning, it started with those things that we think are normal or they're very common, forgetting the little things, and it progressed into, I consider it pretty severe given my age at the time, and forgetting people, forgetting like things I had done. I was in osteopathic school at the time, so not even remembering being engaged in a certain learning experience. Like I can laugh at it now just because it is so ridiculous that that happened. But yes, facial blindness. So seeing someone but not recognizing who they were, even though I had met them previously many times, or forgetting the names of people I had known for like over 10 years. So this was very scary to me, but I wasn't taken seriously. I got lost in the system. I had MRI, saw doctors. They said, nothing's wrong with you. It must be stress. So, but I knew something was wrong, right? I was too young to have mild cognitive impairment. So anyway, life goes on. I'm just like dealing with this very scary memory loss. And just by coincidence, but I want to say the universe was looking out for me. I was talking about poor sleep with someone at my jiu-jitsu gym, and he said, "Oh, did you hear that study that just came out saying that a certain over-the-counter medication is associated with dementia?" This was the over-the-counter medication that I was taking for sleep. And I was like, what? Oh my God. So bells started ringing. Now my whole life made sense. Not my whole life, but my sleep and my memory loss connection made sense. So I went back, I did some research, stopped taking that supplement cold turkey. And then, I had to dig in and find a way to sleep, find out what was wrong with my health. So, the over-the-counter medication I'm talking about is Benadryl. Benadryl also this goes under the product of Sleep Ease, and the brand, the name is not necessarily important, because what is important is the mechanism of action, like what it does when it's in your body. And the chemical, the ingredient that is of interest is diphenylhydramine. Okay, so, and every country is a little bit different with their regulations. So Canada, US, Australia, Europe, these over-the-counter medications are more than likely going to have the diphenylhydramine. But in Zambia, it's a prohibited substance. So we're going to have a discussion today, but some things may be different where you are, where you're practicing. But really the overarching theme I want to communicate is investigate what your patients are putting into their body with a fine tooth comb. So let's see, yes, don't get hooked on brand names. So yeah, so what do I want to talk about first? The diphenylhydramine. And it's in allergy medication, it's in sleep enhancement medications that are available freely, very popular over the counter. But they actually are anticholinergic. Okay, so this is the property that makes them a problem for memory. And if you recall, or maybe it's new information for you, acetylcholine is a neurotransmitter. So it's a chemical messenger in the brain that's important for learning and memory. So if you're taking things, especially taking them on the regular, that are going against this property, there's a good chance it's not that great for you. Now, yes, acetylcholine works in the brain, but there are actually receptors for it all over the body. And for this reason, you can have anticholinergic drugs that are for other things, which we'll talk about a bit later. So actually, I'll talk about it right now. So anticholinergic medications, yes, there are some for sleep. There are some for allergies. There are some for bladder control, and also antidepressants. I think I'm missing one. And why I think this is very important, because the use of antidepressants is probably sky high right now. And unfortunately, very, very high in patients who've sustained a concussion. And I actually have one joke about concussions, and it's not a funny joke either. It's tongue in cheek, but it's very true. It's one of those, I don't know, not funny, but true jokes. So what it is a concussion patient goes into, a medical office. The doctor talks to them for 11 seconds, prescribes them amitriptyline, and calls it a day. So, of course, this isn't all the cases, but I believe there was a research study, I better find it, but that actually something around 11 seconds of conversation happen before a patient is interrupted about their story. And we do know that antidepressants are overprescribed. We need some better options for patients. And here is one, because sometimes the side effects may be undesirable. And that's the thing. You need to inform your patients, and your patients then need to make the decision. Maybe they don't care if they lose their memory because the antidepressant medication is making them feel way better than they did before. And that is their primary goal right now. And they can do that. I have patients that decide to stay on the antihistamines because they just cannot handle the hives or the rashes that they get. But there are always other ways to support them, either by collaborating with a naturopathic doctor or whatnot. So, yes. So the interesting thing is, when we think about these anticholinergic medications, whether it's over the counter, whether it's prescription, but I feel like over the counter is a little bit of a larger issue, because there's this assumption that they're safe, with no regulation on how often someone is taking it, what dosage they're taking. Certainly there's recommended doses on the box. Is that being followed? So it is a little bit of the Wild West. And there actually is research. The earliest research I found was 1988, which is quite a number of years ago, that talked about this negative relationship between anticholinergics and brain health. And in fact, there's very little data showing their safety over time in this over-the-counter product population, I guess you would call it. And actually, so across age and time, yes, there's very little safety data. And if anything, we see that there is a negative relationship. So much of the research is done in older adults. I will pop a few of the studies in the comments after, just so you can look for yourself. And so yes, the studies have mostly been done in older adults, but the hypothesis as to why older adults are suffering from the effects is because of the blood-brain barrier not being quite as great as younger populations. But what do we know about concussion is basically within a very short period of time, that blood-brain barrier is compromised. So that might be important. And another thing we know is just in the general population, poor gut-brain access. Many people, our bodies, whether it's my body, your body, or patients' bodies, need a little bit of help, especially with chronic stress, everything that's going on with the pandemic, blah, blah, blah. So just food for thought, right? When you're treating someone, when you're taking their history, what is happening here? Or what are the different things that might explain what this patient is experiencing? How best can I support this patient? So, for example, I think this is needed for all patients, but especially with concussion, which is the great magnifier of negative things, we need to be extra attentive on things like what medications patients are taking, what kind of food are they eating, what are they doing with their time. And someone might be complaining of memory issues, and you can do all the memory homework, memory drills that you want, but if they're taking a medication that interferes with acetylcholine, then you're not going to get very much progress, because there's something else that's the problem. So in my case, I was taking this compound to help me sleep. But when you take compounds like that, it isn't even a true sleep. So there really is a slippery slope. You think you're sleeping, but you're not sleeping. You're not forming memories. You're not actually getting rest. So you're irritable. Your memory is not so great. Maybe have brain fog, which are also all symptoms of concussion. And that's why I think it's really like a dance, and you learn to have more dance skills and dance better with time, right? So, like I said, look into the medications your patients are taking and how those medications are working in the body. Some antidepressants have this effect, allergy meds, bladder meds. What was the other one? Oh, sleep medications, okay? And it might be a prescription and it might be over the counter. And either way, most people in this group, you cannot be telling your patients what to do, even physicians can't. But I just want to make sure people are informed, right? Because once you're informed, you can make the decision that is best for you, or the patient can make the decision that is best for them. So that is with respect to, I muted myself. That is with respect to concussion. I'm going to take 2-3 minutes and just talk about some other conditions where this applies, or where I just want you to keep your eyes open, okay? So I do treat a number of COVID long haulers, very good results using the holistic, multi-pillared approach that I use. But one interesting thing that's happened, or that's evolving with the pandemic, with COVID long haulers, and we are definitely learning, right? We're always learning about the condition, how it manifests, how it's affecting the body. But what has become a first-line treatment for both acute and chronic COVID is antihistamines. So anticholinergic medications. And patients are being put on these for life, presumably, or right now that's the plan. Okay, you're going to go on these medications for life. So, well, one, I would love for patients to be informed, and then two, if they're informed, they can make decisions. But it will be very interesting to see these patients who are on those medications in a couple of years, what is happening with their brain. I don't think it's going to be good, but again, you have to weigh the pros and cons. Truth be told, when I couldn't sleep, if someone said, you shouldn't take that because it's not going to be great for your brain health, I probably would have said, I don't care, I need to sleep, until I saw the results, right? It's really hard for us to put ourselves into a future self that is not healthy. We can't imagine it. And then the last thing I want to talk about, 2 seconds, is tinnitus. So I talked about this in the cranial workshop that we just had, and I will talk about it again in the TMJ workshop. That is the next workshop, February 6th. Tinnitus, very related to the jaw, but more importantly, there are medications that can actually cause tinnitus. So again, patient comes into your office, yes, they've had a head injury, but is the tinnitus from something that you can help treat? Is it something to do with the tissues? Or is it from a medication that they're on? So again, antidepressants, some of them, for example, SSRIs can cause tinnitus. And again, not every patient is going to experience this, but as you're reviewing their history, their medications, you can start to say, okay, this might be the cause. Some pain medications such as aspirin, ibuprofen, naproxen can cause it. I'm assuming for that it's over time, but it definitely is for higher doses for pain meds. Anti-anxiety medications. Oh, interesting, is hydroxychloroquine, which is the medication that has been used in some COVID cases, depending on which country you are, etc. Some blood pressure medications, antibiotics, Accutane, anticonvulsants. So look over the meds, look at your patient's symptoms. So for example, if your patient comes in and they are also on, they've been on Accutane for a very long time, or what's another one they might be on for a very long time, maybe blood pressure medications or an anti-anxiety medication, and they're having tinnitus, then you want to dig in. Okay, well, did the tinnitus happen before the head injury, or is it only after the head injury? And then also always asking them to circle around with the person who prescribed the medication and say, okay, why don't you circle back with your doctor and have him involved as part of the care team. So I think that was all I wanted to say on this topic that I'm super passionate about. If you have any questions, let me know. I'll answer them if I can. But the take-home message is that we need to do a good history and see what might be contributing, and then support patients the best we can as a team. Definitely collaborating with a naturopathic doctor, I think, is a great idea. But patients might not want to go that route, right? And they have that. They have the right to choose. I took some notes, but yeah, I think that's it. So I hope you're having a great 2022 so far. If you're in Ontario, I think it's been a bumpy start, but man, keep your eyes on the future, because I think it's going to be a good year. And we have to live in the duality that there are always quote unquote positive and negative things happening, and life is a dance. So I'm hoping that you have a wonderful dance today, and I will see you next week right back in here. Bye.